What if everything you thought you knew about cholesterol was a lie? What if the advice you've been following for years, throwing away egg yolks and fearing butter, was based on outdated, misunderstood science? Hi everyone, I'm the Psycho Nurse, and I'm here to cut through the confusion, bust the myths, and give you the unfiltered truth about your health. Heart disease is a massive problem, and the misinformation swirling around cholesterol is making things so much worse. It's leading to unnecessary fear, super restrictive diets that don't even work, and in some cases, dangerous health choices. But that stops today. In this video, I'm going to arm you with the real, evidence-based facts. We're going to debunk the biggest cholesterol myths one by one, so you can finally understand what is really going on inside your body and make choices that actually protect your heart. If you're tired of the lies and ready for the truth, do me a favor. Hit that like button, subscribe to the channel, and ring that notification bell. You do not want to miss the life-saving information I'm about to drop. First up, we're tackling the biggest lie of them all. The idea that the cholesterol you eat is the enemy.
Let us dive right into myth number 1.
Eating cholesterol-rich foods like eggs and shrimp will skyrocket your blood cholesterol and clog your arteries. This is probably the most famous health lie of the last 50 years. You've heard it, your parents have heard it, and it's why countless delicious egg yolks have been tragically sacrificed down the drain. This myth became popular thanks to some early flawed research that seemed to draw a straight line between eating cholesterol and having high cholesterol in your blood. It was a simple, easy-to-understand message, and fear-based marketing ran with it. Soon, dietary guidelines were screaming at us to avoid cholesterol at all costs, and the food industry happily sold us cholesterol-free processed junk instead. But here's the truth, the actual science. Your body is incredibly smart. The vast majority of the cholesterol in your bloodstream, about 75 to 80%, isn't from the food you eat. It's made by your liver. Your liver runs a tight ship. It has a sophisticated regulation system. When you eat more cholesterol, your liver simply produces less to keep things balanced. For most of us, the cholesterol in food has a very minimal impact on our blood cholesterol levels. The real culprits you need to watch are highly processed foods, excessive sugar, and yes, large amounts of certain saturated and especially trans fats. Those are what really rev up your liver's cholesterol production and cause inflammation. As a nurse, I can't tell you how many times I've seen patients who are terrified of eating an omelet, but think nothing of having a sugary cereal or a low-fat muffin, which is basically just cake. They've been scared away from nutrient-dense whole foods like eggs, which are packed with vitamins and protein. So here's your takeaway: don't fear the egg yolk. Focus on a balanced diet rich in whole foods. It is far more important to reduce your intake of processed junk and sugar than it is to obsess over the cholesterol in your shrimp scampi. Alright, on to myth number 2. Cholesterol is inherently bad, and we should always aim to get our numbers as low as possible. This one is a classic case of oversimplification. The media and marketing love to label things as good or bad because it is easy. We hear high cholesterol and immediately think bad. But it's not that simple. Your body needs cholesterol. It's a critical component of every single cell membrane in your body. It's essential for producing vital hormones like estrogen and testosterone, and it's crucial for brain function. In fact, having extremely low cholesterol can be dangerous and is linked to problems with mental health and neurological function. The truth is, we need to understand the different types. You've heard of HDL and LDL. HDL, or high-density lipoprotein, is often called the good cholesterol. Think of it as the cleanup crew. It scavenges for excess cholesterol in your arteries and carries it back to the liver to be flushed out. You generally want your HDL to be high. Then there's LDL, low-density lipoprotein, the so-called bad cholesterol. Its job is to transport cholesterol from the liver to the cells that need it. The problem isn't LDL itself. The problem is when you have too much of it, or when it becomes damaged and oxidized by inflammation and sugar. It's the small, dense, damaged LDL particles that are the real troublemakers, the ones that can wiggle into your artery walls and start forming plaque. The large, fluffy LDL particles are much less of a concern. So it's not just about the number, but the type and quality of your LDL. And don't forget triglycerides. These are fats in your blood that, when high, are a major red flag for heart issues. When your doctor gets your blood work, they aren't just looking at one number. They're analyzing the whole picture, your total cholesterol. Yes, but more importantly, your HDL, your LDL, your triglycerides, and the ratios between them. That's what gives a real assessment of your risk. The takeaway here is to stop thinking in terms of good versus bad. It's about balance and understanding the full picture of your lipid profile. Focus on lifestyle factors that improve the quality of your cholesterol, like reducing sugar and inflammation. This brings us to a huge one, myth number 3. If your cholesterol is high, statins are your only option. Let me be clear. Statins are life-saving medications for many people, especially those at very high risk for a heart attack or stroke. But they are far from the only solution, and they are often presented as the first and only line of defense, which is just not true. The pharmaceutical industry is powerful, and it's easier to prescribe a pill than to coach someone through a major lifestyle overhaul. Plus, statins can have side effects, like muscle pain and cognitive issues, which makes some people hesitant to take them. The truth is that you hold an immense amount of power to change your cholesterol levels through lifestyle. The impact of diet, exercise, stress management, and sleep is profound. Let's talk specifics. For diet, increasing your soluble fiber from sources like oats, beans, and apples can literally bind to cholesterol in your digestive system and pull it out of your body. Omega-3 fatty acids, found in fatty fish like salmon, are fantastic for lowering triglycerides and reducing inflammation. Regular aerobic exercise like brisk walking or cycling can raise your good HDL cholesterol. Even losing a modest amount of weight, just 5 to 10% of your body weight, can dramatically improve your entire lipid profile. I've personally seen patients in the clinic who were told they needed to start a statin immediately. They asked for 3 months to make a change. They got serious about their diet, started exercising, and focused on their sleep. When they came back, their numbers were so drastically improved that their doctor agreed medication wasn't necessary at that time. Now, this isn't everyone's story, but it shows what's possible. So your actionable takeaway is this: medication can be a vital tool, but it's not the only tool in the toolbox. Empower yourself with lifestyle changes first. Work with your doctor, discuss all your options, and be an active participant in your own healthcare. Let us bust another harmful stereotype with myth number 4. High cholesterol is only a problem for people who are overweight or unhealthy. This is a dangerous assumption. It creates a false sense of security for lean, active people who think they're automatically protected, and it unfairly stigmatizes people in larger bodies. The reality is you absolutely cannot judge your cholesterol by your waistline. I've seen marathon runners with dangerously high cholesterol and overweight individuals with perfect lipid panels. This myth completely ignores one of the biggest factors in cholesterol levels: genetics. The truth is that your genetic makeup plays a huge role. Some people have a condition called familial hypercholesterolemia, which is a genetic disorder that causes very high LDL cholesterol levels from birth, regardless of lifestyle. Even if you don't have that specific condition, you can still have a genetic predisposition to your liver producing more cholesterol. Your body weight is only one piece of a very complex puzzle. Factors like your age, your genetics, your stress levels, whether you smoke, and other underlying health conditions like thyroid issues can all significantly impact your cholesterol. In the hospital, we call them the walking time bombs. I remember one patient, a yoga instructor in his 40s, lean, fit, ate a super clean diet. He had a heart attack out of the blue. Everyone was shocked. When we ran his labs, his cholesterol was through the roof. He had no idea because he thought, "I'm healthy, I don't need to get checked." His family history was the missing piece. Your takeaway is crucial. Don't judge a book or a lipid panel by its cover. Regular checkups and blood work are non-negotiable for everyone. Know your family history. It's one of the most important clues you have to your own health risks, regardless of your body type. So let's bring it all home. We've busted some major myths today. We learned that dietary cholesterol isn't the villain we thought it was. We know that cholesterol isn't just good or bad, it's a complex and necessary substance. We've uncovered that statins aren't the only solution and that lifestyle changes are incredibly powerful. And we've confirmed that you can't tell someone's cholesterol level just by looking at them. The big picture is that cholesterol is complicated and your health deserves a holistic, personalized approach, not a one-size-fits-all rule. I want you to leave this video feeling empowered. You are your own best health advocate. Take this information, use it to ask smarter questions, and have more informed conversations with your doctor. Don't be afraid to dig deeper and challenge old beliefs. Focus on a balanced lifestyle. Eat real food, move your body, manage your stress, and prioritize sleep. Those are the pillars of true heart health. If you found this helpful and you're ready to dive even deeper, you are going to love my next video. I'm going to break down exactly how to read your blood work results, so you can understand what all those numbers and acronyms actually mean for your health. To all my fellow truth seekers, don't let heart health lies dictate your well-being. If this video helped you, please give it a like and share it with anyone in your life who needs to hear this. And make sure you are subscribed to the Psycho Nurse for more no-nonsense health talk. Now go out there, be your own advocate, and stay informed.